You've just caught your first cold or flu and you're feeling absolutely terrible. What can you do to help reduce the length of the infection, reduce the length of feeling sick, and help your immune system recover as quickly as possible? I'm Dr. Federica Amati. I'm a registered public health nutritionist and a medical scientist, and I've got some evidence based tips to help you or your loved one get better sooner. The first thing to say is that in terms of diet, try to support your normal healthy diet. So, plenty of fruits and vegetables, whole grains, healthy fats from things like oily fish like salmon, and as much variety as you can. Now, if your appetite is really suppressed, don't worry too much, okay? Hydration is the key when we're really poorly. Making sure that we're still drinking plenty of fluids and that we're going to the loo to do a wee regularly is important, more so than getting 3 square meals a day, especially during the acute phase. It's really important that we take a rest. So if you're not feeling well, or if your child's not feeling well, take that rest. It will actually reduce the duration of the illness if you take that rest early on. Otherwise, it will drag on. Now, in terms of interventions that work, really excitingly, there are some good clinical trials to support that certain supplements can actually help to reduce the duration of the illness. Zinc supplementation specifically, if taken within the first 24 hours of the illness onset, that can actually reduce the duration of the illness by about 33%. The other thing that could help, especially if you're not able to eat well or if your diet prior to getting sick wasn't great, take a multivitamin. So a multivitamin that contains the vitamin C, E, D could actually be helpful for the few days that you're not feeling well. Now, vitamin D, vitamin C, and omega-3 fatty acids all play a role in improving immune system function and reducing inflammation. So how do we get that? Well, vitamin C you can get from fresh fruits and vegetables. You can supplement, and there is some evidence to suggest that it could reduce the severity of an illness by about 12% in adults and children. Omega-3 comes from oily fish such as mackerel, sardines, anchovies, and salmon. If you're not eating that much of that, walnuts, chia, and flax seeds do offer omega-3 ALAs. It's not quite as powerful as the DHA and EPA in fish, so you might consider supplementing for the week that you're not feeling well. If you are breastfeeding, the lactoferrin in your breast milk is going to help protect your baby and help it fight viruses. Breastfeeding frequently, as much as they require, is actually going to deliver a really essential way for their immune system to help fight the virus, which is really exciting. And last but not least, don't fear fever too much. Fever is a normal part of the immune response, and unless it's very high for very long, or it's causing distress to you or your loved one, you don't necessarily have to medicate it just because it's there. Of course, use the paracetamol and ibuprofen to reduce any pain or discomfort, but don't reach for the antipyretics, the fever reducers, as soon as you have a slight fever, because actually that's your immune system working to try and get rid of the infection in the first place. I hope that was helpful.